Hello, I'm Dr. Salim, medicine registrar on call. I'm running the stroke call. What's the stroke patient?
Hello, Dr. Salim. I'm Dr. Ahmed from emergency. We received Mr. Smith 10 minutes back, brought by his family with right-sided weakness and aphasia.
So what's his airway, breathing and circulation?
His airway is maintained. Saturation is maintained in room air of 99. And he's running high blood pressure reading, and he had atrial fibrillation.
What about his blood sugar?
Blood sugar is 9.
Okay. Is there any family member around?
Yes, his wife is around.
Hello. May I know how you are related to him?
I'm his wife, doctor.
May I know what happened exactly with Mr. Smith?
Yeah, we were just eating lunch a while ago, and then immediately he was not able to move his right hand, and he cannot talk to me at all.
So did you witness that?
Yes,
And what time exactly it happened?
1 p.m.
Okay, I will examine him. If you don't mind, you can wait for a while for me, and while examining him, then I will talk to you.
Thank you, doctor.
Hi, Mr. Smith. How old are you? Which month we are in now? Can you close your eyes, please? Now open your eyes. Great. Can you make a fist by your left hand? Okay, now let it go. And now by your right hand. Okay, Mr. Smith, follow my finger. Focus on my finger and follow it by your eyes only. See it to the right, all the way to the right. Okay, Mr. Smith, I'll close one of your eyes. And can you tell me how many fingers do you see? Okay, can you show me by your left hand? Okay. Okay. Okay, now I'll do the other side. Can you tell me which number is this? Show me by your hand. So, Mr. Smith, can you give me a big smile? Okay, can you raise your eyeball and close your eyes tightly? So can you raise your left hand? Keep it up, keep it up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, we'll sit down. Now raise your right hand. Okay, I will help you to raise it. Keep it up. Try to raise it. So please raise your left leg. Keep it up. 1, 2, 3, 4, 5. Okay, that's good. Now raise your right leg. Try to raise it. Okay, move it side to side. Okay, do you feel the touch in this both sides? Does it feel the same? So can you touch your nose by your left finger, then touch my finger? Okay, again. Good. Okay, can you raise your left leg and keep it sliding in your right leg? Okay, Mr. Smith, can you describe what you are seeing? Okay. Can you name this item? What about the other one? Okay, Ahmed, please order stat CT head and CT angio head and neck. We need to move fast and alert pharmacist for TBA.
Sure, Dr. Salim. So we already make the radiology team aware, and we will contact the pharmacist for TBA.
Good.
Let's move. Okay, team, let's move the patient fast.
Yes, Mr. Smith.
Yes, doctor. How is he?
I'm worried that he has stroke. Currently, he is doing a mixed CT scan for his brain and the blood vessels as well. So I would like to ask you a couple of questions. Does he have medical conditions?
So far, right now, he's taking meds for his blood pressure. And he has diabetic, and he's just taking all this medicine.
Does he take any blood thinners?
So far, yeah.
Any recent surgeries in last 3 weeks?
Nothing.
Any previous head trauma or strokes?
Nothing, doctor.
And no recent surgeries in the last 3 weeks?
Nothing. But how is he right now?
Actually, I need to see the CT scans results and then we'll let you know about it. I'll take care of him.
Dr. Salim, radiologist on the phone, and the CT angio is running.
Okay, I'll answer him. Hello, doctor. Yes, Dr. Salim, medical registrar on call. According to the stroke patient, Mr. Smith, what's the findings? So there is no bleeding. Any early ischemic signs? Okay, thank you, that's clear. Hello, Dr. Abdullah. You are the neurologist on call. I'm Dr. Salim, medical registrar on call. Actually, I would like to discuss with you a stroke code about one patient I saw. His name is Mr. Smith, who presented with right side weakness and aphasia, which was witnessed at 1 p.m. Patient NIH score is 15. His BP in higher side 200/90. CT had done and reviewed by radiologist, so there is no bleeding or early ischemic signs. CT angio currently in process. I verified there is no contraindication for TBA. So I would like to give him IV labetalol to decrease his blood pressure, and when it's safe, I would like to proceed with TBA. Sure, I will keep you updated. Sure. Thank you. Okay, Dr. Ahmed. Mr. Smith has ischemic stroke. He's a candidate for IV TBA, but we need to bring his blood pressure down. So we want his systolic blood pressure less than 185 mm mercury and diastolic less than 110 mm mercury. So kindly, if you can give him labetalol 10 mg bolus and prepare the labetalol infusion. I will speak to his wife.
Okay, Dr. Salim, we'll take care about the blood pressure. Meanwhile, we'll trace the CT angio and we'll keep you updated once radiologist call us back. We will ask the pharmacist to keep the TBA ready and we will confirm the patient weight.
Hi, Ms. Smith. Actually, your husband has an ischemic stroke, which caused by a blockage of one of the brain arteries. I am glad that you brought him immediately to the hospital, because every minute counts in this condition and we have to act fast. There is one medication which was proven in treatment of ischemic stroke called TBA or Alteplase.
Would that be effective?
That is clot-busting medication and proven to be effective in the disabilities later on in the patient. Actually, this medication has also a side effects. It carries risk of bleeding in 6% of people. However, the benefits of the medication is way more the risk. It also, in some people, cause some allergies, but the patient will be monitored and will take care of that. So, do you have any questions?
So far, is there any procedures that will be done for my husband? Can we postpone it for some time?
Actually, the faster we give the medication, the better the result is, and less harm as well. Meanwhile, the radiologist is reviewing the vessels MX. If there is any major vessel occlusion, he may be a candidate for removal of that occlusions. Any question do you have?
Nothing, Dr.
So do you understand what we are going to do?
Just make sure that everything will be okay.
No worries, so we'll take care of him. Okay, Dr. Ahmed, I spoke to his wife. She agreed for the TBA.
And we already give him the labetalol. Blood pressure dropped within the target.
See? So I think we'll proceed with the TBA. So what his weight?
60.
60. So the dose is 0.9 milligram per kg. That will give him 54 milligram.
Yes, that is what we confirmed with the pharmacist.
Great. So can I get 10% of that dose as a bolus? That will be 5.4 milligram.
Yes, that is already prepared.
Okay, great. Okay, sir, you have an ischemic stroke. We'll give you medication that will absorb the clot. Okay? Bolus is given. Now I'm giving the flush. Now give the remaining dose infusion over 1 hour.
Okay, sure. And just to let you know, we received call from radiologist, and they found left M1 occlusion.
Okay, great. I will notify the neuro intervention team.
Sure.
Hi, Mrs. Smith. Hi, my name is Dr. Ali Al-Galoushi. I'm a neurointerventionist, okay? And I was notified by the medical team about your husband, Mr. Smith. Okay, so have they explained to you what's going on? Okay, what did they tell you?
We'll take a medicine.
Okay, so obviously, like they explained to you, he has a stroke. And so the stroke that he has is actually resulted from a blockage of one of the blood vessels in the brain. So you did great that you brought him immediately, okay, to the hospital, because as you know that, when there's a stroke, that time really matters, okay? And the medical team also did a great job. They give him the clot busting medicine, okay? But, also one of the treatments that we do consider for patients who have stroke is to look at the blood vessels. If there is any blockage of one of the major blood vessels in the brain, then we do a procedure to take that clot out, okay, or the blockage. We open the blockage basically, okay? So in your husband's situation, so basically the CAT scan or the CT scan of the blood vessels showed there is a blockage of one of the major blood vessels in the brain, okay? So what we need to do right now is to do a procedure to take that clot, with a catheter, okay? So basically how we do that, we do it under general anesthesia. Sometimes we do it also with sedation, without anesthesia, but in his situation, I anticipate that he will need general anesthesia because there is a problem with communication, okay? And so basically we're going to use X-ray guidance and to basically advance very thin catheters, like these are basically thin tubes that will go all the way from either the groin or from the wrist all the way to the head and neck region, and we will advance further catheters to basically retrieve the clot, okay? So this treatment is very powerful, that it actually helps a lot, and it has been shown in many clinical studies that this is the treatment that provides the best outcome for patients with stroke, okay? So, and the chances of success are very high, it's about 90%, okay? And this medicine is this treatment is now the standard of care anywhere in the world, okay? So any procedure carries some risk associated with it, and this treatment carries about 6% risk of causing problems. And these problems could be causing a new stroke or bleeding in the brain, and any of these could be devastating, okay? Also, this treatment, because we use catheters and we navigate the blood vessels, there's a small risk of causing a tear in the blood vessel, either on the neck vessels or the brain vessels. And also, there's a risk associated with access site, which basically if we go from the groin or from the wrist, there's a risk that, damage to the artery that might result in a bleed or ischemia, which is basically blockage of the vessel that would need a sort of intervention, surgical intervention. Obviously, this procedure, we do it under X-ray guidance. We use contrast to visualize where we are in the arteries. And this contrast also has some risk to cause kidney damage as well, okay? All right. Overall, this treatment is very powerful. It's very accepted, actually as the standard of care nowadays. And the risk of the treatment is way less than the benefit of the treatment, okay? Do you understand that? Do you have any questions? Okay, so then we should proceed immediately for this treatment. So because as patients with a stroke, every minute counts, and every minute there are many millions of brain cells die, okay? So we're going to go ahead and start. I will have you sign the consent form on his behalf, okay? All right? Okay, thank you. Stroke is a common emergency. In this case scenario, we demonstrated a patient who presented with ischemic stroke within the thrombolysis window, and the patient was also candidate for mechanical thrombectomy. The patient received both treatments successfully.
In this case scenario, we highlighted the importance of multidisciplinary approaches in order to get a successful management and outcomes.
We hope this video is helpful in guiding you how to run stroke point.